Hello and welcome to the latest installment of Hellie's clinical trial adventures. We're on the third installment now. And for you who maybe haven't seen any of the other things or read any of the blogs, my name is Hellie, and I am signed up for a clinical trial where they are hoping to see the results of cancer drug on MS patients. The main thing is to see what the side effects are like, but what they're hoping for this drug to be doing is to do some remyelination on scarred areas in your brain. So I had a really long day at Addenbrooke's yesterday. Maybe I should say I'm actually on the trial, because last time I was waiting for a phone call to find out whether I was on the trial or not because of the blood work that they were testing, and yes, so I am. Well, which is why I was up at Addenbrooke's for a long time, but I might have given it away. Sorry. So yes, I went up to Addenbrooke's. This was nice in some ways because I didn't have to fast this time. This is apparently the only time that I could go up there without fasting. So I had my coffee and my breakfast, so I was definitely in a better mood than when I came up there before, because I shouldn't really be around people when I haven't had coffee. And I went up to the research part of Addenbrooke's. I found my way there without getting lost, so that was a plus. If you haven't been to Addenbrooke's is a very, very large hospital, and I swear it grows week by week, and it gets very confusing to find. And this time I was really tested because I had to go to a lot of different places. I started up by the research part, and I met one of the doctors who was in charge, which was one of the doctors that I spoke to on the phone originally, Dr. Nick. Who was very, very nice, and answered some more questions of mine, and he managed to sort of just talk me through the same things and just made sure that I still wanted to do this and all those bits. He then gave me a prescription for the drugs or for the placebo, because I obviously could end up with placebo. It's a 50-50 chance. And told me to take that down to pharmacy. But before that, I had my blood taken for testing again. They do the pregnancy test again, and then you see the EDSS assessor again. So you're starting to kind of know the drill by now. And that all went fine. It was the same as last time. So they sent me down to the pharmacy to hand in the prescription. They told me that it's going to take a long time to get the drugs. And I think this is one of the things that is a bit of a annoying thing, but you can't really do much about, because they're obviously very overworked at the pharmacies in these big hospitals, so it takes quite a long time for them to get the drugs ready. But that was fine. I had some appointments after this one, so I just went and sat and worked in the cafe, and then it was time for me to go and have my visual evoked potentials. Now, I've had this done before, but it was quite a long time ago. I don't know, most of you might have had them already. If you haven't, it's one of those very strange things. So you sit and stare intently at a screen which got like a checkerboard on it. So it's white, black, and in the middle there's a red square, a rectangle, probably, not square. And then you get these fetching electrodes on your head with lots of wiggly cables coming out and then attached to a computer, and the technician can then see your brain waves. I'm quite geeky, so I find it really interesting, so I was asking her what were you actually measuring, what were you trying to see. So now I might say that I'm geeky, but I'm not very good with actual science like that, so I'm not expert on it, so I'll try and explain it as I understood it. So when you're looking at these squares and the white goes to black, and they switch colors, and the time it takes from you to see it to it to go sort of record it in the back of your brain, it takes a certain amount of time. And because of the scarring that occurs in MS, apparently that time can be a bit slower, so they can then see that they measure the time it takes. So I thought that was quite interesting, because when you sit and stare at it and it just flicks backwards and forwards, I always think it feels like you're doing some weird IQ test and you're really not getting it. And it's like, wait, I'm failing at this. Another thing that was very interesting is that you sit and stare at this, but obviously your mind starts drifting because it's incredibly boring. So I started thinking about, what will I have for dinner? Do I need to pick up the kids? And every time this happened, the technician kept on telling me, focus, focus. So it felt really weird, like she was reading my mind. But obviously, she could tell from the signals that I wasn't really, even though I was looking ahead at it, I wasn't actually focusing my eyes on this red square, rectangle. Hard to remember. So that's what you do in those tests. So you had to sit there for a while. And the annoying thing was they had booked me in for an MRI scan just an hour after. And because this test took a while, and we were also a little bit late to start because they had some problems with on cables and technology, I had to really get my running shoes on and run from one department to the next to get to the MRI scan. The lovely technician actually came with me, so she was very nice. So she deposited me at the MRI scanning place, which is, I think, the third different place that I've had an MRI scan at Addenbrooke's now. I'm starting to think that I could write some reviews of these MRI scanners, because I think I've been in three different ones in three different departments. Can do like a consumer review. This one was actually very quiet comparatively. You could potentially have fallen asleep in it. I didn't. And they were just as boring as ever. I don't know how many scans I've had in total, and I've mostly been fine. I have had a panic attack in once, and I've been in one of these MRI tubes, and it was horrible because you do feel quite claustrophobic. And generally I'm quite fine, just letting my mind wander without anybody telling me off in there. And but yeah, this time it was fine. It's just a bit stiff and uncomfortable in the long run because it was a long time. Halfway through, you kind of get pulled out and they inject you with this isotope type thing, so they will check any differences with the that it shows up on these scans. Don't ask me to explain that part because I really don't understand it. I just always joke about the fact that you're in this magnetic scanner and you get injected with some kind of radioactive thing, and should you come out with superpowers? Sadly, I never ever do. Anyway, so that's all done. It felt like you're getting like a proper MOT, more or less. Hopefully they won't find anything else wrong with me. But yeah, so they are checking everything this week. And if this week and the following, I guess, and if nothing shows up as being, no reason, another reason to not start taking the drugs, I will start taking the drugs on Tuesday, so a week from now. That week I'm not actually going up to Addenbrooke, so that's a bit of a bonus. So I just get to take the drugs by myself, and then yeah, that's basically it. The drugs still scare me, the size of them. In my next exciting vlog, I shall show you them. I will probably film it whilst I'm actually trying to take them. It might be a disastrous idea, but it felt like it would be a bit of reality for you there. So yeah, I think that's probably it from me for this time. But yes, stay tuned. Bye.